All right, so in this chapter, we're going to look at cannabis and cannabinoids. So, marijuana is pretty much one of the more commonly used non-pharmaceutical drugs in the world. And given a lot of the ramifications as far as the legal aspects that surround its use has changed significantly over the past couple of years, it's important in sports medicine to kind of, look at and kind of understand, if, the adverse health effects related to it, or the even looking at some of the potential therapeutic benefits when we're looking at these substances. So in looking at this, and again, we have some terminology and categories we have to look at. So again, cannabis itself is just the general plant that we look at. And when we look at the cannabis plant, it has over 80 biologically active components, or we call active cannabinoids, present. And when we look at, so in particular, like one type of cannabis plant is marijuana. And again, marijuana contains the chemical components responsible for feeling high when it gets utilized. So, and again, those compounds are called cannabinoids. Now, when we look at this, so cannabis contains various levels of what we call delta 9 tetrahydrocannabinol, or what we know as THC. THC is the component in the cannabis plant, or when we look at marijuana, that kind of gives that sort of euphoric intoxication feeling when it gets utilized. Okay. The other part of that is the cannabidiol, or what we know as the CBD, which we utilize. You've seen that in a lot of supplements. Like if you go to supplement, places that carry over the counter supplements, you'll notice CBD supplements. That's cannabidiol. There's potential benefits from that, but the cannabidiol doesn't cause that euphoria and intoxication. So that's basically the part of the cannabis plant, but they don't have THC in it. Okay, so cannabis itself is widely available. There's multiple forms of administration. It could be eaten. It could be, we obviously know it could be smoked. It could be vaporized. So, and now we look at the difference, because we start talking about, obviously people use it for both recreational and medical purposes. Our kind of focus is going to be obviously more on the medical purposes and some of what we see with that. In particular, where it really started to come from, and who a lot of people actually attribute a lot of the medical application to this, is the story. Your textbook talks about it in the chapter. A girl named Charlotte Figi, who had seizures brought on by something called Dravet syndrome, and she started to have a significant reduction as she started to use medical marijuana. I believe it was, she's pretty young when she started doing it, and she started to have a significant reduction in her epileptic seizures. And they started to see this more and more, in particular with CBD, that individuals started to have individuals who have seizure disorders, if they were treated with CBD, they started to notice that they had fewer seizures. So when we're looking at the types of cannabis, and we can look at the various properties of cannabis. So Cannabis sativa is basically, when we look at the whole marijuana plant, and again, that's kind of the most widespread variety. So when we look at Cannabis sativa, obviously there's going to be higher levels of THC because it's the whole plant. Obviously that's going to create that situation of euphoria, that hallucinogenic high that you get from that. It also does stimulate appetite. So that's one type there. You have Cannabis ruderalis, which is kind of the informal name for some of the shorter plants that grow in Europe and Central Asia. There's also what we call Cannabis indica, which are kind of shorter plants that are grown. And Cannabis indica, which is another one, has higher CBD levels, but also does contain THC. Okay, so Cannabis sativa has higher THC levels, but also contains CBD. Cannabis indica has higher CBD levels but also contains THC. And that one in particular, the Cannabis indica, which I don't have up here, does tend to be good. It does have very sedating effects and is very relaxing. So there's the belief that it can reduce some anxiety and pain associated with that. There's also hemp. So now, in order for hemp to be kind of legally grown, it has to have fewer than 0.3% cannabinoids. So for a plant to be considered hemp, it has to have less than that. Otherwise, an individual can be prosecuted under federal law. And again, cannabis, it is part of the Cannabis sativa family. So it should be noted that the National Institute of Health actually does support research on cannabinoids and the endocannabinoid system. So again, and that actually includes some studies using the whole marijuana plant. So there is more and more being done to kind of research this regarding various types of medical conditions. So it's important to understand how cannabis is going to act in the body and how it produces its effects. So cannabis essentially is going to act on the brain by binding to, we have cannabinoid receptors, and that's where it's going to produce its various effects. And those particular receptors that we're talking about are part of our endocannabinoid system. So the body actually has its own endogenous cannabinoids, and we'll talk about that more a little bit later. But so because it has endogenous cannabinoids, it has these natural receptors. And again, when cannabis binds to these receptors, that's where it produces those kind of classic effects that we think of when we consume cannabis that has high THC levels, that euphoria, intoxication. So those particular effects come from the reaction of that. And the endocannabinoid system basically consists of the kind of, again, the cannabinoids that our body produces, or the endocannabinoids, the cannabinoid receptors, and the enzymes that will naturally synthesize and degrade endocannabinoids. So our body will produce its own cannabinoids, endogenous cannabinoids, but they also have to be broken down, and those are the enzymes that will break those down. And the endocannabinoid system is responsible, so that the brain circuits that it impacts, or the brain circuits that operate here, are those that are important for like decision making, mood, and our stress response. So as we're talking about all this, it should all kind of make sense. We all kind of have an awareness as to what for instance, like when an individual, smokes or consumes marijuana, what it, the effects that it has should kind of make sense as to how a lot of this, physiologically is occurring. So many of the effects of cannabinoids and endocannabinoids are modified by what we call these G protein coupled receptors that are present in the CNS. And there's two different types that we look at here. So we have the CB1 receptor, which is the most abundant G protein. These receptors actually bind with THC and mediate many of the psychoactive elements of cannabinoids. And there's a high density of these particular receptors in the basal ganglia and in the brain. And we look here, so, when we're looking at kind of some of the effects, that these are key components for the descending pathway and the circuitry for stress, fear, and anxiety. And these are also expressed in most other tissues in organs as well. So we see these receptors in other areas of the body. So again, this is these particular receptors are really the most abundant that we have. Then we have the CB2, and these particular receptors binds with CBD. And again, this is found in the CNS, but it's actually mostly distributed in the periphery. So again, it's high density on cells and tissues of the immune system. So this one's a little bit different. So again, we have CB1 is the most plentiful. It's the highest density in the brain and basal ganglia. CB2, we look at that being found more in the CNS. CB1 is a little more sensitive to the THC. CB2 binds more readily with CBD, which is the cannabidiol component, the part that doesn't produce that euphoric sensation, but has other effects. So the cannabinoid analgesic effect facilitated by this, so this is when we're looking at this, so the analgesic effect of cannabinoids are facilitated by the endocannabinoid system. So if we're looking at it strictly from the standpoint of pain relief, When we both look at the pain pathways in the central and peripheral nervous system, there's parts here. So again, endocannabinoids are, at various sites throughout the nociceptive pathways, and we've talked about these pathways in other courses, and they're generated in response to pain. So what this means is when we have a situation, that causes, if we have an injury and that causes pain or there's stress, endocannabinoids are generated on demand and produce a short-term anti-nociceptive effect. So again, it's kind of that whole our body's natural way to alleviate pain. So endocannabinoids play a key role in the resolution of acute pain states and in kind of mediating stress-induced analgesia. So they get elevated at various sites in the nociceptive pathway in chronic pain states, which again kind of highlights their role. So endocannabinoids are kind of our body's sort of like natural pain relief mechanisms are effective for this. And this is where then the thought process behind using cannabis, using cannabidiol in order to help. One of the big things we use these for is for helping to alleviate pain. So looking at the pharmacokinetics of THC, and again, THC is going to be, again, we're talking the psychoactive component of cannabis. So again, it does get rapidly absorbed in the bloodstream following inhalation and then gets metabolized. And again, the primary absorption and metabolism occurs in the liver. And then you basically look at it does get distributed to the highly perfused organs of the body, so the brain, heart, kidneys, and liver. There does get secondary distribution to adipose tissue, particularly in those who use it on a regular basis. So with chronic daily THC exposure, THC is very lipophilic, so it will get stored in the body's adipose tissue in individuals who do use it consistently and on a regular basis. Again, and a lot of, again, THC concentrations in the body a lot of times will be based, it does depend upon the potency of the particular cannabis. So again, depending upon how potent the cannabis is, that's another thing that does then kind of base how much is present in the body. Now, as far as excretion, it does get excreted in the urine, so the kidneys are obviously responsible for the excretion. Again, with daily use, so again, if we're looking at as far as, say, producing a positive drug test, individuals who do, for instance, use cannabis on a regular basis, they can produce a positive test for up to 4 weeks. So again, people who smoke less frequently than daily, that could change differently. So again, it just really depends upon the use, as far as how long it'll be detected in the urine. Now, so then a question does come up about passive secondhand exposure. So, for instance, if someone's around somebody who is, say someone has to get drug tested for work and they're concerned if they're around somebody who smokes marijuana, are they going to get secondhand exposure? Again, it really does depend on some things. So it depends on the potency, the duration, and then the intensity of room ventilation. So they did look at a study as far as secondhand exposure to cannabis. Your book discusses this. So again, they basically looked at in close proximity, the smokers smoking in close proximity to non-smokers in in an unventilated room, high intensity short-term cannabis smoke environment. The results actually did indicate that extreme exposure could produce a positive drug test. However, it's generally at lower cutoff levels than those used in federal workplace drug testing programs. So even in a significant exposure, so heavy smoke, low, no room ventilation for a longer period of time, you could still find it in the urine, but it's at a lower cutoff than those used for most drug testing programs. So in other words, you're not as likely to have even if you're around somebody and you did happen to inhale some passive secondhand exposure, the levels it's going to show isn't going to be enough for most drug tests. So looking at acute and chronic effects of cannabis use. So again, a lot of the behavioral and subjective effects of cannabis are going to basically be dose dependent, and acutely individuals within 10 minutes will experience some of those effects. So again, what we classically think of as the effects, when individuals utilize recreational marijuana, the sedation, relaxation, altered perception of time, lack of concentration, issues with learning and memory, mood changes, some of the paranoia and panic reactions that individuals have, and impaired psychomotor activity are some of the things that we kind of look at acutely with cannabis use. Now, interestingly enough, because it has such a wide range of effects, so when we look at typically, especially when we look at like a lot of your street or recreational based drugs, things will typically get classified as a stimulant, a sedative, or a hallucinogen. Because of the wide range of effects that individuals have and experience, it doesn't necessarily get classified. You will kind of see some resources classify it as a hallucinogen, but a lot of people don't experience that effect. So it doesn't really fall into kind of one of those, sort of like, neat classifications, if you will. It doesn't fall neatly into one of those. So again, a lot of neurological things that we look at, which we had discussed, even like depth perception is something that could be impacted. We're going to talk about some of the other physiologic effects that occur with this as well, kind of in the next slide, where we kind of look at just some of the somatic feelings that individuals get from utilizing cannabis. One of the big things that you do have to be aware of, and we'll discuss this later on, is that when individuals start utilizing cannabis when they're younger, there's the potential for some cognitive development to be affected. So and another thing that does tend to be an issue is that dependency tends to be more of an issue when starting at a much younger age. And when we look at a lot of long-term use, so some of the chronic effects, we see a lot of those things related to, like, the diminished energy and ambition, a lot of those issues that we see with individuals that chronically use it. Coupled with, you do have to be concerned, particularly when individuals are smoking cannabis, are the pulmonary issues associated with it. So that's kind of like another long-term issue, similar to what, when people smoke nicotine cigarettes, you do get a lot of pulmonary issues related to this as well. And again, there's various mental illnesses. Again, particularly we look at dependency with a lot of the chronic use. And again, your book does kind of highlight, like I gave you some things here, but again, make sure as you're kind of going through and you're reading, note some of the other negative effects. So this is a figure out of your book. These are some of the other sort of physical changes that individuals experience. So you see with the eyes, the reddening in the eyes. There's also some decreased intra-articular pressure that can occur. Individuals will complain of dryness in the mouth, some issues with sensations in the skin, and then the increased heart rate, muscular relaxation. So these are just some of the short-term physiologic effects outside of the kind of like cognitive neurological issues that we pointed out. So it's important to be mindful of the fact that even though we are finding and it is true that we are finding some medical benefits, particularly regarding pain with different variations of cannabis, it is important to note that it is not a harmless drug. So now, one interesting point when it comes to cannabis is that death due to overdose is actually not possible. So you actually can't overdose on it and die because of the effects that it actually has on the brain. So you won't see like an overdose death related to cannabis. However, you are going to get changes to the brain, particularly with long-term use. And again, some of the evidence related to the changes. So again, you get all types of changes to the brain. So there's structural, there's functional, there's chemical changes to the brain, and that's where maybe some of the issues related to mental illness comes in as it's related to that. Now, again, if you look at some of the research on that, and your reading talks about this, they don't necessarily look at the evidence as causal. They only have associative evidence, and part of that is just because of some of there's not as many randomized controlled trials on it. So that's something important to point out and be aware of as well. However, there is associative evidence kind of showing these effects. So it's definitely not something, regardless any benefit that we find, where, again, obviously people should haphazardly use and abuse cannabis. So that's part of the reason why we want to make sure that, again, if someone is using that, we, make sure, especially now with, again, changes in laws, make sure that a person is not abusing or possibly using them when they shouldn't be. So another thing to point out is the synthetic cannabinoids, and your book gives some examples. So like K2 and spice are just some examples, and again, familiarize yourself with some of the other sort of street names, if you will, of these drugs. But there is synthetic marijuana. Again, it produces some different effects. So these are psychoactive drugs that people will utilize and purchase for that reason. These are human-made, mind-altering drugs, and they do yield various psychotic symptoms. So again, these individuals that will utilize these will experience that extreme anxiety and paranoia, hallucinations associated with it, and they tend to be much more intense and unpleasant than kind of the naturally grown marijuana, if you will. So individuals will utilize these, and many times they are intended for vaping. So, and they contain many Schedule 1 active chemicals. So this is an important thing to point out, because again, people may attempt to use these, and they may even attempt to use them in an effort to sort of self-treat, various, medical issues. But it is important to point out that there's no medical benefit related to these. Again, most of the time, individuals are using these recreationally. It is important to note, though, that some people may try them in an effort to to treat the condition, but as again, they tend to be popular with young people because of the fact that the effects that they perceive from them. So, however, manufacturers do evade DEA regulations, so people have been able to obtain these, and again, many times they are available in different forms. Again, vaping tends to be one of the more popular forms of this. However, even just vaping itself, again, there's occurrence of lung injury related to vaping, so it should be important to, again, in educating people that it is not a safer version of administration of this, or even any form of nicotine. But a lot of the e-cigarettes and things like that, they do market these synthetic versions of THC for this. But again, the health concerns are pretty evident, and individuals should be made aware of this. So now turning to cannabidiol, we had talked a little bit about CBD to sort of start the chapter. So CBD is derived from the cannabis sativa plant. Again, so it can be isolated from it, and it is classified. It does get classification as a Schedule 1 drug. The difference here is, and when you look at a lot of CBD supplements, they do not contain the psychoactive element of THC. So it is different. It is a derivative coming from the cannabis plant. So this is something that is going, and there is a lot of ongoing research, because we are starting to see more and more some benefits, and even people who take CBD supplements, again, kind of anecdotally do say that there are some benefits to treating certain things. So they are kind of looking at this in possibly in more research to see if there is a true benefit for use. So it should be noted that other than specific approved prescriptions, CBD products are not evaluated or approved by the FDA for use as a drug. So this means that for, again, for any CBD product available that you can buy, there are things unknown about it. So again, there is ongoing research to look at this. However, again, we don't they're not marketed or shouldn't be marketed to treat any particular disease. There's not a particular dosage that we know is safe. There's also some concerns, and this is again something that's getting looked at, is do they interact with other drugs, and if they have any dangerous side effects. So this is getting looked at more and more. So even though these are more readily available, these are things that individuals need to be made aware of, is that we don't know all the effects. So again, pharmacokinetics and dynamics. So we look here. So your popular administration routes of CBD, various forms, oral, sublingual, topical. So for instance, a lot of, a very popular form is oral consumption. They make gummies that are based on this. Actually, at the the company Charlotte's Web, which was, I think I had mentioned that sort of landmark administration with the young girl with epilepsy was effectively named after her. And again, that's one type that gets utilized. So the action is at cell surface receptors. Again, the idea there is to look to potentially promote analgesia. So again, one of the potential benefits that a lot of people will use CBD is to help relieve pain, and a lot of times orthopedic pain. So that's something to be mindful of. Obviously in sports medicine settings, it's going to be something that a lot of people are looking to alleviate themselves from. Again, as I talked about earlier, there is the potential for adverse effects and drug-drug interactions. Again, we're still learning kind of more and more about how this particular substance will interact with other drugs. So you do want to be mindful of that. Typically one of the big recommendations is make sure not to consume, alcohol with these, because again, we don't know of some of the effects. And it should be noted that even though your CBD supplements don't contain the THC has been removed, there are reports of THC types of side effects being reported. So again, people have reported like increase in hunger. There is this slight euphoric sensation with it, and even like things like the eye reddening can sometimes occur with this. And again, the reason why people are looking to use these, again, a range of kind of like mental health issues, structural issues, pain issues, are a lot of the reasons why individuals are looking to this as a form of treatment. So looking at the direct medical application, so the medical cannabinoids, so again, actually using it to treat a disease or alleviate symptoms related to something. So, and again, medical cannabinoids or medical grade cannabinoids can be administered again in various forms. So we'll talk about that. The primary role that we look at that has typically been utilized for a lot of the medical cannabinoids or cancer patient pain. So that's probably one of the more common things, and a lot of from the side effects, particularly when we look at chemotherapy, spasm and nausea are some of the other things that are kind of related to this. The FDA has actually approved two cannabidiol-based drugs, so dronabinol and nabilone, to treat epilepsy. So we had talked about Darvit syndrome, and that's been approved by the FDA. So those are two. And again, be aware of the brand names of those. Again, I'll have you kind of look at those in the reading, but that's something to be mindful of. So again, the important to note that the THC and CBD content can vary in a lot of these, and it's important to administer no more than 4 times a day. So they don't suggest utilizing that. And again, that's to avoid a lot of the adverse effects, particularly the cognitive impairing things that can typically be associated with these particular substances. So again, there's medical marijuana advocacy from the recreational use history. So this is something that has been, has changed over the years. The laws have even changed since the writing of this book. there's been some changes to the law. And again, particularly as it relates to again these severe forms of epilepsy. So Dravet syndrome is something where there's actually no anti-epileptic drug that has been shown to be effective for it, and this actually has a high mortality rate. And again, this is where the initial application of cannabinoids have been used. And again, some of the research, again, it kind of goes back and forth. There's some ideas behind maybe, the research really just should be pushed a little bit more. The New England Journal of Medicine actually did report, at least did use a randomized controlled trial to show that CBD use did result in a greater reduction in convulsive seizure frequency than placebo, in particularly with this drug-resistant form of epilepsy. Now, again, as always, more since it's only been one, they are recommending, further research. So we do have to be aware of some of the contraindications. So pregnancy, individuals who already have mental illness, and individuals with a cardiac history, because of some of the cardiac issues that can occur with certain variations of cannabinoids is listed. Again, research-wise, again, this is typically what we sort of look at with, what they kind of look at where there can be medical benefit with cannabinoids. Again, cancer patients, particularly with any related pain to that, or even some of the nausea that they get as a result of their chemotherapy. Individuals, with muscle wasting diseases, like individuals with HIV and AIDS when they're experiencing weight loss. And again, some other conditions they look at as well, things like multiple sclerosis, just general pain management. Again, they do find that there's a lot of, particularly in not only in cancer, but diabetic retinopathy. Again, there's always going to be adverse effects associated with it, as there could be with a lot of other drugs. And even PTSD, which is a very difficult mental health condition to treat, even with counseling, that there's potential benefit there. So they are looking at it as far as a treatment. There's also cannabis-based medications for even things like fibromyalgia, for individuals that are experiencing a lot of pain associated with conditions such as that. And one thing to note before I do move on, I just realized to make this point. One of the things to make sure is that individuals are always using medically approved administration. So you want to make sure that, if individuals are, going to utilize, make sure that they are getting, prescription based, and that they're using, standardized sort of medical delivery methods to deliver these. And again, that's just to make the administration as safe as possible. So looking at it as far as performance effects and sport regulation, obviously in many our primary sports medicine settings, we have to look at athletes, and as far as what will be regulated and what they're allowed to take. So interestingly enough, so when we look at performance enhancing substances and many things that get tested for, again, it has to have an actual medical or substantive improvement in performance. Cannabis actually doesn't have that. So there's no overt performance enhancing benefit of cannabis. And if you look at some of the effects, particularly with psychomotor skills, it can actually be a detriment. Now, despite that, the World Anti-Doping Agency does prohibit during competition. However, CBD is no longer banned. So individuals will not, if they do use CBD, now keep in mind, again, if you say, well, like, what about CBD supplements? Again, they're not regulated by the FDA, so you do have to be aware of that. If someone is going to take an unregulated supplement, there's always the risk of possibly giving a positive test. So there are some sports organizations that have reconsidered or are reconsidering bans. Again, they're starting to recognize, basically, and probably the big thing is, as we talk about like an opioid crisis, that is possibly utilizing some form of cannabis in whatever form, and in pain management, particularly in the NFL, where pain management becomes a really big issue. So that is something that we do have to look at. um, as far as, should these things be reconsidered in how we utilize them, and that's kind of start some of the push for the medical use behind a lot of this to start with. And in particular regarding the IOC, so again, they want to look at more research concerning consistency and methods of use with this. So THC kind of falls under, since it doesn't really have a direct, regarding the IOC and the World Anti-Doping Agency, it doesn't fall under necessarily a performance-enhancing substance. It falls under what they call a substance of abuse. So it falls kind of in the same category with like cocaine, heroin, um, methylendodeoxymethamphetamine, or what people know as ecstasy. It falls underneath that classification, so they kind of have it kind of fall underneath that. And again, part of this is they talk about a dichotomy of reality and perception among athletes. So it does negatively affect, and this is part of the reason why, again, it's not a performance enhancing substance, because we do know that psychomotor skills can actually be affected negatively with the use of cannabis, and even looking at cognitive function. So again, in a lot of ways, we look at it as, well, it could potentially have a lot of negative effects with performance. So there's something to be mindful of. However, athletes do perceive some beneficial effects, again, primarily coming from the standpoint of, like, even like with joint pain and things like that, they do kind of recognize that. So again, this is something that has evolved over the years as far as, cannabis being banned, and I'm sure will continue to evolve in the upcoming years as more research gets done. So as far as regulations, and this is probably where a lot of the big changes have kind of taken place. So again, many states have enacted various laws. California became the first law to pass permits that use medical cannabis. Another thing that has kind of come out, so certain components of hemp and cannabis sativa have become legal with the 2014 Farm Act, and that basically just approved CBD from three specific sources. So the three specific sources that it looks at is any type of industrial hemp cultivated in compliance with this legislation, and I kind of talked about that at the beginning of the semester, the beginning of the lecture, looking at how that gets regulated. Imported non-psychoactive hemp and elements of that cannabis sativa that are not part of marijuana as defined in the Controlled Substances Act. So those are some specific sources that have started to have basically been approved in the different CBD substances. So again, there's a wide range of state regulations, so that's why it's important to kind of know what the regulation is in the individual state. So again, cannabis dispensaries can authorize for a medical purpose. Again, written patient consent is required. So again, it'd be good to know in your state what some of the rules are regarding this for use. So some of the thing with this, there's ubiquitous ability, but there's still no manufacturing standards. So that's important to know. Again, so a lot of and some of the concerns, particularly with CBD products, is that there's some issues still with testing and mislabeling. So one of the things that, like, your textbook talks about is, like, there's some CBD products, for instance, that were, making claims of that they can treat cancer and treat Alzheimer's disease. And certainly those are not, even going as far as they could help with opioid withdrawal. So those are things that you should be aware of. So that is concerning still. And again, when utilizing these. So again, make caution that they're not approved for those particular treating those particular circumstances. So those are some of the concerns, particularly with a lot of the again, like supplements that you can buy. Again, there are warnings regarding illegal sales. So again, in any type of unsubstantiated claims. And as I talked about, and where this becomes important with athletes, is that again, make sure to realize that some contaminants have been found, particularly with THC products. So you need to be aware of that. And again, some of the safety issues. we obviously know that, again, people don't experience all the same adverse effects, but if there's safety issues and contaminants with the way that a certain product is designed and developed, it could possibly, enhance those or create other health issues. So we need to make sure that, individuals are aware of that, and if they are going to use, products, that they have to be, scrutinized a little bit more before they start using them. So in summary, again, so there's clinical recommendations you can make. So your book talks and gives 10 recommendations that can lower the risk of associated issues. So again, take a look at those. Probably one of the biggest things is, and it should make sense, avoiding early age initiation of cannabis use. So there should absolutely be nothing consumed before the age of 16 years old. That's probably something that's important just for the developing brain. There's others that are listed, so make note of those, just to be aware, because those are particular things that, as an allied healthcare professional, you should be aware of. Again, it tends to be, don't just come out and say that, oh, it's something is bad and you shouldn't do it. Like, again, you're an educated healthcare professional, give good education behind it, be aware of those recommendations. So again, there is risk, and again, part of the bigger things we look at is, particularly with younger individuals, some of the acute and chronic health problems, and again, evidence-based information and discussions. So some of the, things with research that we pointed out, again, instead of just saying, well, something's bad, mention that, but mention some of the potential benefits, and how it should kind of be managed. So again, part of what is really kind of taking off, and where most of this took off from the start, in addition to some of the other neurological things, is, again, just some of the benefits regarding pain. So staying on top of the research with this could be something, worthwhile. So again, make sure to be reviewing that. And again, as more jurisdictions start to legalize, it is becoming, even like, the stigma associated with it is obviously being lifted. But again, it's not a completely harmless substance. And that's not necessarily like this big major red flag. I mean, a lot of the medications that we've already talked about are not completely harmless. But it should note that, again, part of some of the issues associated with it is it's still not regulated a whole lot, which means that there could be some of those potential issues associated with it. And these are your learning objectives associated with the topic. So again, make some notes of, again, I kind of did point out some things to look at as a part of the reading and kind of looking at the text. Again, that may be some additional information that you would like to add to your notes, particularly from this chapter.